Let's be immediately after the swixx symposium. Excellent. In fact, the topic of the symposium is quite up to date. It's a hot topic, and it's definitely a hot topic because there is a new hope for this entity, for this diagnosis, and the diagnosis is hypertrophic cardiomyopathy, and definitely. This is one of the challenges during the last, let's say, tens of years. The lack of medication and lack of hope. But we have a big hope now with several new medications, one of which is already into the guideline. Could you advance one slide? Yeah, these are the nice faces of the participants in the symposium. Okay, next slide, please. I don't have anything special to share with you as a conflict of interest. And in fact, we three of us, we are going to try to explain what I mean about the hope for hypertrophic cardiomyopathy. Next slide, please. In fact, the main feature of the hypertrophic cardiomyopathy all over the world is considered the left ventricle hypertrophy. In case there is absence of another cardiac or systemic or metabolic disease, in the 99.9% of the cases, the HCMP is translated into left ventricle hypertrophy. Next one. And the clinical presentation is really very important. It presents with marked left ventricular hypertrophy, frequently asymmetric, but sometimes it can also be homogeneous, which can be difficult to diagnose, especially in hypertensive patients. It's difficult to decide, is it a simple hypertension, left ventricular hypertrophy, or it's the disease, hypertrophic disease. And furthermore, because during the hypertrophy process, unfortunately, the arteries of the heart will not grow. In many cases, the patients have even angina, and it's quite difficult to decide if it's a secondary relative lack of perfusion because of hypertrophy, or it's a real ischemic heart disease. Next slide, please. And this complicated our lives. Next slide, if possible. And we have, unfortunately, I don't see the next slide. What is very important? Excellent. I mentioned that there are several phenotypes. There are several phenotypes of the hypertrophic cardiomyopathy. And the most important boundary, the most important discrimination is between the obstructive and non-obstructive or latent obstructive. The non-obstructive, in most of the cases, is comprising global hypertrophy, but without involving the left ventricle outflow tract. And this is crucial. In fact, it's crucial to see on the imaging that it can be echocardiography and CMR, magnetic resonance, to take a look at the type of the phenotypic type of the hypertrophy, because there is a difference in the treatment. Next slide, please. So I mentioned already CMR, magnetic resonance. We can see not only the size of the hypertrophy, but also the fine tissue problems with the hypertrophy. Next slide. And even the interstitial fibrosis. In some cases, the fibrosis is definitely part of the disbalance into the supply of the blood supply of the hypertrophic myocardium. And on the echo, we can observe between 25 and 30% of the patients left ventricle outflow tract obstruction. And this is the obstructive, the so-called supraortic stenosis. And to prove that, we have several methods. Of course, rest echo, exercise echo, or exercise MRI. Next slide, please. And the morphological diagnosis is definitely very important, and I will show you one of our cases. It's a very young 33-year-old male. In fact, in the majority of the cases, the diagnosis is done in the 4th decade of the life of the patient. In this situation, this gentleman had in his family history sudden cardiac death history, and this was probably one of the features, one of the reasons to be diagnosed a little earlier. Next, and we did right heart catheterization, and in fact we established this is the echo of this gentleman, and like expected, because the diastolic dysfunction that is very typical for all kinds of left ventricular hypertrophy, we saw elevated pulmonary artery pressure. Next, please. And we have not only the echo, next slide, and we have also impressive result on the MRI pictures. Next slide. Yes, it's very well seen, the septal extreme hypertrophic of the septum of the left ventricle. Next slide. And what is, I mentioned already that the 2/3 of the patients are male, so the female gender, but is was associated with a worse prognosis, so there are less women, but a worse prognosis. And I mentioned that the 4th decade is the most often scenario to detect the diagnosis. Next slide. And we have several, and the underdiagnosed and under-recognized HCM is quite prevalent. So not more than 1% of these patients are really recognized on time in order to receive the appropriate treatment. Next slide. Next slide, you see that the majority of the patients are not recognized, and because of the subtle signs of on echo, some contrast injection is also very useful to prove the diagnosis. Next slide. And what are the possibilities of treatment? Of course, conservative medication, beta blockers, calcium channel blockers, and disopyramide, in order to use their negative inotropic effect and a reduction of the tension of the myocardium and a reduction of the continuing hypertrophy. If not efficient, next slide. If not efficient, especially in obstructive version, obstructive phenotype, we have the so-called invasive possibilities, invasive surgical or invasive percutaneous. Next slide. In our local practice, we had more than 70 cases, and in I'm calculating, I think 11 of them were hypertrophic obstructive cardiomyopathy, and in these 11 cases we did endovascular septal alcoholic ablation. That is one of the methods of invasive treatment, and during that time our colleagues from cardiac surgery did 5 patients with surgical excision of the hypertrophic myocardium in order to liberate the outflow tract obstruction. Next. And in fact, this is my conclusion, that there is a huge unmet need for efficient treatment in hypertrophic cardiomyopathy. And my colleague, Professor Velchev and Postajian, will show you more data about what is next, not only on the horizon, but already into the guideline. And thank you very much for your kind attention.
Thank you, Ivo. We are now switching and
I'm joining you
from the Floya, and we will waiting for you for the discussion. Okay.